to highlight another new innovative and creative alliance that we are participating in that goes right to the very heart, God bless you, of our members' experience with cancer. I don't have to tell you that the experience right now is some 6 times higher than the average population. We don't have to be convinced that the significance of our members incurring cancers is a healthy worker that's healthier than the average population when you begin your career. I mean, I think sometimes we lose sight of that factor. It's not just that we're experiencing it at higher levels. We're talking about a population that begins a career healthier than the average population, and that just that is significant in then illuminating the experience of cancer. We've approached it in a lot of ways. It's been mentioned. We're trying to remove the flame retardants out of materials so that we're reducing the toxicity of the environments our members are working in. We are continuously improving the PPE that our members, the ensembles they're wearing, the hoods that they're using, to try to protect them more and more. But the truth is that we know that we're still getting it absorbed in areas around the wrist and the neck. We're trying to change the protocols and the training, yes, and a lot of it's going to be resisted probably from our membership. I know it's implemented in many places, but we are approaching the time where you're not going to be throwing your turnouts after a working fire into your rigs any longer. You're going to be bagging them up in sealed bags, and then you're going to be getting them clean. So we're trying to approach this in multiple ways. We're passing laws, as we well know, that is recognizing cancer as an occupational occurrence, and to cover it by workman's comp and retirement consistent with a job-related experience. But in trying to approach this in multiple ways, including now a national cancer registry that will really give, as I said this morning, the medical community, the clinical community, the scientific community, more and more data to be able to make these connections. We're also taking another big leap. I mentioned first thing out this morning, those that are visiting our Center of Health of Excellence for Behavioral Health. It's an incredible enterprise that you now are a part of that's going to take care in another way the health of our members, keep them alive. We've also now begun a journey with another new and cutting edge company and a doctor, Dr. Patrick Soon-Chong, who has, in our view, created the 22nd century diagnostic tool and process to be able to more specifically identify a cancer, which then will lead to a much more specific and effective treatment protocol. I'm not a doctor, and Ed and I have spent a lot of time discussing this, and we have not only been out to Century City to meet with the doctor and his professional staff, and we brought 11 locals, most of them here in this room. The initial beta test, if you will, or the beta exercise is to focus on our locals that have self-insured plans, that have more opportunity to change the benefit structures in their plans. But what we learned is nothing less than fascinating. It also comes with a level of controversy. We give it to you straight. But it's important enough that it, is the cover of this month's magazine to begin to explain and to go down another path of great innovation and creativity that will ultimately result in our members having their cancers, as unfortunate as they are, better diagnosed so that they can be better treated and actually cured. It's a new diagnosis process that uses supercomputers. Much of it hard for me to try to explain, except a fascinating new approach that allows a supercomputer to take, a sample of a cancer and to be able to analyze all, is it 200,000 or 20,000? 20,000, all 20,000 proteins that are in a cancer. Now, I'm not going to try to give you a headache, but I'm trying to emphasize that this is so new. And what being able to analyze that will do is, instead of the industry right now, and I'm just calling it like it is, an industry that, certainly creates and develops and sells chemo, and the current treatment protocols basically load cancer patients up, in most cases, with chemo that basically will kill you, except they just don't give you enough to quite kill you. And then their hope is, and the plan is, that it'll maybe kill that cancer. The recidivism rate, though, is more often, as we know, than we want to admit. And so we are aligning ourselves with Patrick and his company, NantHealth, in order to begin to authorize, publicize, to make available to our members this new diagnosis approach and tool. And in doing so, we're going to be taking on part of the current industry. We were not warned, but we were told very directly that the current oncology community, many in it, do not view this new diagnostic tool as maybe a little witchcraft. What we think and believe, and what I think will be proven out, certainly now and over time, is that this is so effective and cutting edge that the translation of it is telling the current oncology community in many ways that what you've been doing for 30 years is wrong. Now, there's nobody in any profession, including ours, that wants to be told by some new evolving professional in our industry or in any industry that what you've been doing is wrong. So there's been some pushback. There's been some interesting articles. You all Google it. You need to Google it. But the truth of the matter is that we also got to watch and experience what seems to be nothing less than incredible, a tool that then is able to help unleash our own immunity systems and, God bless you, and killer cells, so that there can be less and less chemo used and much more specific and direct treatment, successful treatment that can be made. So on this alliance, I know that we have with us the area vice president. Russ Johnson's here. I don't know where Russ is sitting, but there he is. Russ, welcome.
Great job.
Oh, and hopefully I was half-assed correct. I mean, All right. But I just want everybody to know we're rolling this out in milestones, so that it's like, well, then how do we get it? Or why is it my local? Or why does my local get selected? I just want you to know that our strategy was take our locals, the first 11, and I believe 5 of them have succeeded already in changing their benefit structures that will then authorize and allow this new test to be prescribed by a doctor for a member that is unfortunately diagnosed with a cancer. And we're going to then move it out. We're going to go down the self-insured route and get those kind of in place. And I know Boston's is either done or right on the edge of Thursday. Meeting Thursday. And I know Houston, I shouldn't call them out because I'll miss someone, but we're strategically making those steps first. Then we're going to take the steps to have our municipalities that are self-insured and begin to work on those that provide their own insurance, but through a carrier, but still self-insured. And then we're, in a final step, we're going to be, and as we are now, working with carriers for the fully insured plans to be able to get those carriers to authorize, if you will, this test when prescribed. It'll take, this journey will take a little time, but we're being very direct about it. If you haven't, I encourage you to take a look at the magazine. It'll give you much more detail and a better explanation of all of this. But on the back of our cancer registry, I want you to know this is another new and additional approach in trying to hit this scourge on our members from multiple angles. So you'll be hearing a lot more about it, and I'm confident that as we continue down this path, we'll have all of our members that'll be eligible and able to receive this kind of diagnosis and treatment.